Assalamualaikum, my name is Azahar.
Hi, I'm Arisa. Hi, Assalamualaikum, I'm Aina.
Hi, I'm Zuhair.
Hi, my name is Akila.
We are here to enlighten the viewers about a crucial topic, which is myocardial infarction. In this video, we will explain on what is myocardial infarction, the factors, diagnosis, treatments, and complications of myocardial infarction. Let's go!
Hi, I'm gonna tell you a few things about myocardial infarction. So, what is myocardial infarction? A myocardial infarction, or for short MI, or coronary thrombosis, commonly known as heart attack, occurs when blood flow decreases or stops to part of the heart, causing damage to the heart muscle. Myocardial infarction refers to the tissue death for infarction of the heart muscle, myocardium, caused by ischemia. This lack of oxygen delivery to myocardial tissue. It is a type of acute coronary syndrome which describes a sudden or short-term change in symptom related to blood flow to the heart. Unlike the other type of acute coronary syndrome, unstable angina for example, a myocardial infarction occurs when there is a cell death. This can be estimated by measuring a blood test for biomarkers, the cardiac protein troponin. When there is evidence of an MI, it may be classified as an ST elevation myocardial infarction, or for short STEMI, or non-ST elevation myocardial infarction, or for short an STEMI, based on the result of an electrocardiography. The phrase heart attack is often used non-specifically to refer to myocardial infarction. An MI is different but can cause cardiac arrest, where the heart is not contracting at all or so poorly that all the vital organs cease to function, thus might lead to death. It also distinct from heart failure, in which the pumping action of the heart is impaired. However, an MI may lead to heart failure. That's all from me. I'm gonna pass this to Akila. There is a dust in my can.
Hi, my name is Akila Husna. Okay, what cause of myocardial infarction? The main cause of myocardial infarction is a blood clot, what we call as thrombosis, that form in main coronary arteries or one of each branch. So when this happens, the blood flow to the part of the heart is blocked. Blood clots usually do not form in normal arteries. However, blood clots can form if there is an atheroma in the arterial layer. Atheroma is like a patch of fat or plaque that form on the inner lining of the artery. Plaque from atheroma can form gradually over several years in the coronary arteries. Each plaque has a firm outer layer and a soft inner fat core. In the case of myocardial infarction, a fracture of the plaque is formed in the outer layer of the atheroma plaque. This is called plaque rupture. When the soft inner core of the plaque is exposed to the blood flow, it can trigger the clotting mechanism in the blood to form the blood clots. When the formation of atheroma is produced, it will inhibit blood flow as well as the transport of oxygen and nutrient to the heart. Then, myocardial infarction occurs due to the death of part of cardiac muscle tissue. This is due to the reduction of coronary blood flow. Okay, this is thrombosis, the blood clots, and the other one is atheroma. See, atheroma in the yellow. Atheroma is the fat, right? Here. Is blocked in coronary. Who is at risk of getting myocardial infarction? Myocardial infarction usually occurs in people over 50 years of age. However, myocardial infarction sometimes occurs in young people MI myocardial infarction is 3 times more common in young men than in young women. But after menopause, female hormones no longer protect women from the risk of heart disease. The risk is the same both in men and women. Certain risk factors can cause a trauma to form. Among them are diabetes, obesity, high blood pressure, smoking, diet, family history, and not active. Thank you. Bye.
Hi, how do doctors diagnose acute myocardial infarction (AMI)? The doctor in charge will start by doing some clinical assessments, which are history taking and physical examination. History taking is performed by listening to patients complain for AMI symptoms such as chest tightness or pain, or discomfort in upper back, jaw, or left shoulder. They might also experience dizziness, nausea, and cold sweat. Patients might also have risk factors for AMI. Patients who are in older age group, smoke, have high blood pressure, family history of heart attack, overstress, and illicit drug abuse are more prone to develop AMI. After history taking is completed, the doctor will do a physical examination. Patients who have AMI are usually in pain, anxious, and agitated. They might also show clinical signs of AMI, which are leg edema, pallor extremities, and shortness of breath. The doctor will then check the patient's blood pressure and heart rate, which might be abnormally high or too low. If AMI is highly suspected, the doctor would run a few investigations, which are ECG, which stands for electrocardiogram, records the electrical activity of our heart, cardiac markers, and coronary angiography. ECG should be done within 10 minutes of presentation and would show abnormal recording of AMI. There are 2 types of AMI based on ST segment on the ECG recordings, which are STEMI and non-STEMI. However, it may be normal in the early stage. Second, the patient's blood can be sent to the lab to detect presence of cardiac markers. Dying cardiac markers will release certain enzymes such as CKMB and cell contents like troponin T into the bloodstream. Early detection through rapid blood tests can reliably diagnose AMI. Finally, coronary angiogram is a minimally invasive procedure that detects coronary artery blockages by using special chemicals and special X-ray machine. The blockage can be removed by performing percutaneous coronary intervention, PCI, or angioplasty. Now that we know how doctors diagnose acute myocardial infarction, let's listen to how do doctors treat AMI. Thank you.
Hi, nice to meet you, but I'm here to talk about how is myocardial infarction treated. Let's go! So I will use this brochure as a medium to explain deeper about this topic, which is the treatments and ways to prevent it. First is angioplasty. Your surgeon will use this method to unblock the arteries that supply blood to the heart. But how is it done? The doctor will make an incision in your arm or groin, then they insert a catheter with a tiny inflatable balloon on the end into your artery. And once it's in position, the balloon is inflated to widen the artery. Other than that, a small mesh tube called a stent may also be placed at the side of the blockage to prevent the artery from closing again. Next is coronary artery bypass graft. This is to improve blood flow to your heart. The surgeon will use blood vessels taken from another area of your body to bypass the damaged arteries. And a certain type of bypass surgery depending on how many of your arteries are blocked. There are some medications that can also be used to treat it, which is a blood thinners such as aspirin. Other than that, a medication such as thrombolytics can be used to dissolve clots. Antiplatelet drugs, nitroglycerin, beta blockers, ACE inhibitors, and pain relievers can also be used to treat the heart attacks. Last but not least, how can acute myocardial infarction be prevented? First, You must have a heart-healthy diet. This diet should largely consist of whole grains, vegetables, fruits, and lean protein. But the most important thing is you should reduce sugar, saturated fat, trans fat, and cholesterol in your diet. These are to make your diet to be more effective. Next is exercise. But you must speak to your doctor first if you have had a heart attack recently. Quit smoking and avoid buying around second-hand smoke will significantly lower your risk of a heart attack and improve both your heart and lung health.
Hi, just now you already heard about what is myocardial infarction, how it can be happen, and what are the symptoms. And now my turn, I want to explain you about complication of myocardial infarctions. Based on facts, that the patient will get 4 major complications of myocardial infarction. If you want to know, stay tuned. Let's go. The first complication of myocardial infarction is first, sudden death. Fatality from myocardial infarction remains formidably high, with 50% of patients who die after an acute coronary occlusion doing so within the first hour after the onset of symptoms. Death is commonly due to dysrhythmia, ventricular fibrillation. Second, cardiogenic shock. The term cardiogenic shock is used to describe a complex syndrome associated with inadequate perfusion of vital organs, most significantly the brain, kidney, and heart. It occurs in 50% of myocardial infarction patients, and of these 90% will die in spite of recent advance in therapy. Patients with an anterior myocardial infarction or who have lost more than 40% of functional myocardium are greatest risk. Most deaths occur within the first 24 hours, although a small number of patients may die more than 7 days later. Let's go for the next one. Heart failure. Heart failure is one of the most severe complications of myocardial infarction and results from the heart's inability to provide an adequate cardiac output for the body's metabolic requirements. Heart failure complicates 25 to 50% of acute myocardial infarction arising from the loss of contractility in the damaged myocardium as left ventricular remodeling occurs. It tends to develop inducedly during the first few days following myocardial infarction. Symptoms are not usually due to reduced cardiac output, but rather the body's compensatory mechanism to maintain adequate output. For example, fluid retention leading to pulmonary or peripheral edema and increased sympathetic activity causing tachycardia. And the last one, angina pectoris. Recurrent and persistent angina symptoms may occur in the early post-infarction period and have been associated with unfavorable prognosis. Angina pain is due to the increased oxygen demand on the viable myocardium. Cardiac catheterization and surgical revascularization may be indicated in this patient. I hope with my explanation will give you benefit to you all guys. See you soon later. Bye. Assalamualaikum.
No doubt, the rapid changing in medical technologies such as ECG machine and contrast dye for cardiac markers tests and practice patterns of doctors nowadays have contributed to better health and quality of life amongst us. However, when it comes to our health, prevention is much better than cure. In Islam, the Quran and the Hadith encourage Muslims to live in moderation wasatiyah. In the Quran, Allah says, "O people, eat of what is on earth, lawful and good, and do not follow the footsteps of the evil one, for he is to you an avowed enemy." Surah number 2 and ayat 168. According to Islam, man should benefit from the material prosperity bestowed by Allah, but one should be moderate in leading his life in this world. Moderate lifestyles can lead to good health, and good health can decrease the risk of developing conditions such as myocardial infarction.
Thank you for listening.
Bye.